Hi, my name is Angela Tierney. I'm glad you're here in my new hire class to learn ESI, which I'm sure you already know if you're a seasoned ER nurse. I myself am an ER nurse, and I've been so for about 8 years. What's your name?
Tom.
And how long have you been an ER nurse?
Over 10 years.
Okay, so you're familiar with ESI, correct?
Yes, ma'am.
All right, well, this should be nice and easy. So we're going to go over ESI Triage, a triage tool for emergency department care. What is ESI? It is Emergency Severity Index. It's used in triage to assess the acuity of the patient based on the number of resources that are utilized during the care of the patient. Now, what is considered a resource? Thomas?
Lab, CT, X-ray, ultrasound, EKG, stuff like that.
And then one question, you'll see that there's procedural sedation up there. How many resources is that?
2.
Yes, sir. And what is not considered a resource?
Just routine stuff, like an HMP, PO meds, splints, crutch training, stuff like that.
Very good. Now, how is ESI used? ESI is used by the triage nurse, and that is to prioritize patients, basically telling you what patient is unable to wait. Triage nurses, they're to perform a quick, focused assessment and then assign the patient an acuity level according to the ESI algorithm. Now, I made just, bones here of the algorithm. It's 5 levels. 5 is a non-urgent patient, use no resources, so your medication refill, something like that. Up to 1, which is your most urgent, which is life-saving measures. So if you have a CPR that comes in, those type of patients. And I have a handout that I gave you here. It is the actual ESI algorithm. And these you'll probably see hanging in the triage booths. Just as a reminder, if you have a question about anything, I know sometimes you'll be, is this patient a 3? Are they a 4? I'm not sure. So you'll see here where it says 1 is the life-saving immediate intervention. So they'll give you your yes or no, so it's pretty user-friendly. If it's a no, it takes you down to the next block, which is B. Is it high risk? Is it somebody that I would give my last bed to in the ER? That's usually the best question to answer that. If not, then you'll go down to your 3 based on, the danger level, how many resources you would use, you would go from there. Do you have any questions about this?
No.
Okay, we're going to move on. And now, as they say, practice makes perfect, so we're going to do a few case studies just to make sure that you're comfortable, which I'm sure you are, but just to ensure that we're on the right track, okay? I know sometimes things can get muddy when you haven't had a class in a while, and even I've been there. So, case study practice number 1. 27-year-old male is into the emergency room, says, I think I scratched my cornea when I took my contact out last night. Left eye is tearing and red, pain is 6 out of 10, vital signs are normal. What ESI level would you assign?
5.
That is correct. He needs an eye exam, he'll be sent home with a prescription, but other than that, we're going to send him home with a follow-up appointment for ophthalmology. Yay! So, case study practice number 2. EMS comes to ER with 20-year-old female with a medication overdose is suspected. Her mother found her lethargic and not acting right. She called 911. Patient has a history of depression. On the exam, you find multiple superficial lacerations to bilateral wrists. Respiratory rate is an 8, and the SpO2 on room air is 85. So what would her ESI level be?
I'd put her at either a 1 or a 2.
This one is a 1 because she does require immediate life-saving intervention because you're looking at your respiratory of an 8 and 85 O2. So, because of the O2 respiratory rate, she's unable to protect her airway, so she's going to need to be intubated as soon as possible. Case study practice number 3. We have a 50-year-old female. She comes to the ER wearing a sling after being in a bicycle accident. She states she fell off a bicycle, landed on her left arm. She's having pain to her left wrist and has a 3-centimeter laceration on her right elbow. She states, my helmet saved me. What would her ESI level be?
3.
That is correct. You're going to use 2 or more resources. She's going to have an x-ray at least and wound repair to the laceration on her right elbow. So you got it. Congratulations. Now, the follow-up we're going to have you do for post-test is I handed out an ESI post-test here with 10 questions, and I will let you do that on your own time, and when you're finished, we will go over the answers, and I will give you a completion grade. Do you have any questions at all about this?
Nope.
All right, well, good luck to you, and thank you for coming to my class today.